Good afternoon, everyone. My name is Kathy Ottenhoff, and I'm one of the BORN coordinators. On behalf of BORN Ontario, I'd like to welcome you to the BORN Provincial Rounds update of the BFI Statistics Report in the BORN Information System. A question and answer period will occur at the end of the presentation. Please type your question into the chat box in the lower left-hand corner of your screen, and feel free to enter a question at any time during the presentation. As you have heard, these rounds are being recorded and will be posted to the BORN Ontario website. We're very pleased to have Linda Young and Sandy Dunn presenting today. Linda is the Director of Maternal Newborn Child Mental Health, Interprofessional Practice and Organizational Learning at Toronto East General Hospital and the lead for the BFI Strategy Implementation for Ontario. Linda's work experience includes roles as a clinical nurse specialist in low-risk obstetrics at Women's College Hospital, a quality manager at Providence Healthcare, an educator for maternal newborn pediatrics nursing at the University of Toronto. Linda also worked as a program director for more than 2 decades in 3 GTA hospitals. She has worked at the Toronto East General Hospital for the past 5 years, during which time Toronto East General became redesignated as a baby-friendly hospital. Sandy Dunn is currently the Acting Scientific Manager and Knowledge Translation Specialist for BORN Ontario. As a member of the Data Analyst Reporting Team at BORN, she has been involved in the development and implementation of the Maternal Newborn Dashboard and other standard clinical reports available in the BORN Information System. These reports have been designed to facilitate use of the data for quality improvement. Sandy has worked closely with the BFI Strategy Implementation Committee, the BORN Data Collection Review Committee, and the BORN Report Development Team to facilitate revisions to the BORN breastfeeding data elements and to update the BFI Statistics Report. So welcome to both Linda and Sandy.
Thanks, Kathy. It's Sandy speaking first. I'm just going to outline the objectives for this presentation today, and then I will hand it over to Linda. She's going to begin the process. We will describe the BFI strategy for Ontario, discuss the reporting requirements for the BFI designation. Linda will do that for you, and that will give you that will ground this presentation into the background that provided and informed the process we followed to enhance the data elements and develop the reports that we are going to talk to you about. We'll also review the components of the first of the 2 reports that have been designed to support the BFI initiative. I'll be able to present some BFI indicator rates for Ontario for the past fiscal year and give a very brief sneak preview of the new and upcoming BFI Indicator Status Report that's planned for launch in October. So without further ado, I'll hand it over to Linda, who's going to begin the process of our presentation. Over to you, Linda.
Thanks so much, Sandy. And I just want to let everyone know I'm really delighted to be sharing some of the work we're doing in the province to assist you with developing best practices to support breastfeeding at your organizations. The work I'm going to be describing is based on a partnership among Toronto East General Hospital, the Provincial Council for Maternal Child Health, and the Best Start Resource Centre at Health Nexus. Next slide. So why would you want to become baby-friendly, and why are we such interest in the province? The impetus for the BFI strategy actually came from the release of the Healthy Kids Panel Report in the spring of 2013. The report recommended that all children be started on the path to good health through exclusive breastfeeding for the first 6 months of life. The report also underlined the value of the baby-friendly initiative to enhancing breastfeeding support in the hospital. The report cited research indicating that organizations that have implemented 6 or 7 of the steps of the BFI actually provide better breastfeeding support and have greater success rates. The report also cited research that underlines the importance of ongoing support for breastfeeding success after discharge through community organizations. Next. So the BFI implementation, the initiative itself is actually based on two documents. The World Health Organization 10 Steps to Successful Breastfeeding and the World Health Organization UNICEF International Code of Marketing of Breast Milk Substitutes. Together, these two documents have identified the basis for worldwide standards and policies that enhance the successful initiation and duration of breastfeeding. They also help us to protect breastfeeding by ensuring that industry marketing of breast milk substitutes meets ethics standards. Next. So, this slide outlines the 10 steps for the practice outcome indicators for both hospitals and community health services that have been developed by the Breastfeeding Committee for Canada. Each of the steps identifies the number of practices within them that are necessary to fully support breastfeeding success. And so in order to become designated, you must meet all of the 10 steps. Next. This slide talks to the commitment that the Ministry of Health and Long-Term Care made to breastfeeding about 2 years ago. And that, in that document, the ministry announced funding for 3 initiatives. Our initiative actually is focused on providing hospitals and community health organizations with the training, tools, guidance, and resources to help achieve the World Health Organization's baby-friendly designation and to adopt best practices that meet BFI requirements. You may be familiar with the other 2 initiatives that are also happening concurrently. One has been the provision of 24-hour support through Telehealth Ontario for breastfeeding mothers, and the second one has been a number of initiatives launched by Best Start Resource Center at Health Nexus to enhance breastfeeding with high-risk populations that show lower breastfeeding rates. Next. So this slide in the beginning talks to, first of all, the number of currently BFI designated organizations in the province. We have 3 hospitals, Toronto East General, St. Joe's in Hamilton, and Grand River Regional Hospital in Kitchener. We also have 2 community health centers that are in Ottawa, and they are Somerset and Centertown, and we have now 15 public health units, or we had 15 as of June. I haven't updated this, so it might actually be more designated in the province. So our focus on the right-hand side of the page is the group that's in turquoise. That was our original focus. So 92 hospitals, community health centers, Aboriginal health access centers, NP-led clinics, family health teams, and birthing centers. This is a total of more than 360 organizations. And we are in the process of offering support to midwifery practices that also wish to join the BFI initiative and become designated. Next. So the goals of the BFI strategy are to increase the evidence-based support that we provide to women who wish to breastfeed that will result in an increase in the number of healthcare organizations that are pursuing baby-friendly designation, an increase in the number of healthcare organizations that are actually achieving the baby-friendly designation, and a continuous improvement strategy for BFI designated organizations to support sustainability. Next. The expected impact of our work is that we will see an increased rate for the initiation of breastfeeding, an increased rate of exclusive breastfeeding at discharge from hospital, a decrease in the non-medical supplementation in hospital, an increase in the duration of breastfeeding across the province, an increased number of organizations with BFI designation. And ultimately, this work together, we will provide a positive impact on the health of infants and mothers in Ontario. Next. It's important to realize that there are many paths to becoming a baby-friendly province, and you may be working on becoming a baby-friendly, implementing baby-friendly best practices. Your goal may be to become BFI designated, or your goal may be to simply focus on supporting breastfeeding in the community through the services that you offer. Next. So I'm going to spend a few minutes talking to you about the resources that the BFI Strategy for Ontario has actually developed and we are implementing currently. First of all, we have an implementation toolkit and workshops that we have already offered a number of these across the province, and we are continuing to offer them this fall. This is a one-day workshop. 2 participants from each organization can attend, and it's a free service. And it's a prerequisite for attending the 20-hour workshop and obtaining the 20-hour toolkit. The 20-hour toolkit provides people with all of the resources you need to teach the 20-hour course. And the 20-hour course is a requirement for all direct providers in an organization wishing to become baby-friendly. The toolkit includes the slides, the teaching notes, a workbook for the participants, and activity directions. So this allows the individuals who come to the workshop to teach in a standardized manner the required content for BFI designation. And we currently have a number of 20-hour workshops happening across the province, and we'll continue to offer some of those in the spring. So look out for them in your area and do join us in attending them. I will say these right now we're offering in English. We do have French translations of the materials almost completed, and we will be offering 1 or 2 French language workshops within this year. The next thing is patient education materials. So last year we translated a number of existing resources that were at Best Start into 18 languages. So that we have a total of 18 languages. 2 of the languages are Aboriginal, English and French, and then another 14 languages. These are all available to be downloaded from the Best Start Resource Center at Health Nexus, and we are pleased to announce that we will have 3 new resources by the end of October issued to you. 2 of them are on feeding premature infants, so the late preterm infant and the premature infant, and the other one is a resource guide for formula feeding that will allow us for those mothers who must use formula either to supplement or to feed their infant, standardized guidelines across the province. We will also be releasing imminently the Baby Friendly 101 e-learning module. We have this set up in English. We thought we would just delay the release a little bit to get the French language version completed, and this as well should be coming out within the next few weeks. This e-learning module can be used to introduce a number of people at your organization, just get them familiar with the concepts of baby-friendly. It can also be used as a refresher just before you have one of the capacity or site visits by an assessor. The next item, the site visits for hospitals, and we just had one this morning here at East General. We have a whole process for offering site visits that's standardized between the 3 hospitals, and so it doesn't matter which one you come to, and we will cater the site visit to your needs, and it involves typically about 2 hours of dialogue and touring of the designated hospital. The next item there, presentation templates. We have a number of templates that we have shared with individual organizations based on their specific needs that can help you in your implementation journey. We have a clearinghouse coming very soon, and it will be housed at Health Nexus at the Best Start Resource Center, and this will organize confirmed BFI resources that people can download and use, so they are easily accessible and help you in finding a variety of resources at your fingertips. The last thing is our microsite for information, resources, and advice. This is for connected to the TEGH website, and we invite you to send us questions or concerns or ideas for things that you think we should be working on at any time, or to ask for coaching support. So that would be at www.tegh.on.ca/BFI Strategy. Next slide. This slide shows you the full roadmap for implementation of the BFI strategy across Ontario. I'm not going into the details, but I will tell you, you can see across the top that we have gone from information and awareness building to engagement of organizations across the province to implementation. And right now we're focusing on engagement and implementation. We also are hoping to get to designation and sustainability, and we're putting in place things that will help you along the bottom there to track your progress in your BFI journey and to enable some system building for the province. Next slide. So I just want to talk to you a little bit about tracking progress with the BFI. And one of the things we did as part of the BFI strategy was strike a working group that worked with BORN Ontario in a really strong partnership to develop some new reports and to refine the data elements that are actually being collected so that they're more accurately collected and they're clearer for the people entering and collecting data. So the 2 major areas of change that we've got in the BORN reports are revising the data elements to match the BCC changes and to create this new report. The report itself covers all of the indicators that the BFI assessors would ask you for. And just so that you know, BFI, the BCC changed the population that they're looking at for their indicators from 37 weeks and above to all births. And the indicators that we actually will give you your results on are birth by C-section without general anesthesia, birth by C-section with general anesthesia, infants admitted to your NICU or similar units, infants exclusively fed human milk from birth to discharge, infants at your institution who received at least one feed that was not human milk for a documented medical reason, and infants who received at least one feed not human milk with no documented medical reason. So the documented medical reason would be related to all of the acceptable reasons, such as a baby with a low glucose that needs to be supplemented based on the protocols for hypoglycemia. The breastfeeding rates that BCC tracks, this slide shows you how they're sorted out. So from your total births, you have a division of breastfed and non-breastfed infants. The breastfed infants are either exclusively breastfed or they are breastfed, but they might have received one feed that's not human milk. And then that last group I just mentioned will either be supplemented with a documented medical reason or not have a documented medical reason in their chart. Next slide. So I just want to reiterate that Christina and I are here to help you in your BFI journey. Don't hesitate to contact us. And I'd like to turn it back to Sandy, who's going to give you the details of the new report.
Thanks so much, Linda. We really appreciate the background. It's a wonderful overview of information to help give some context to the information I'm going to now present, which is really looking at the revision process in a wee bit more detail and the actual components of the report. The report that's been released was released in June, and the upcoming report that we will release in October. So Linda has made these points, a few points. There's a little bit more detail that I've included in my slides, though. Definitely endorse and support and agree with her description of the close collaboration between BORN and the BFI Strategy Implementation Committee. There was a specific advisory group within that committee that we worked together with, or many meetings and long hours of discussions to hone through the details and the evidence and look at the indicators to do this work. So kudos to everybody's contribution to that. So our goal to start out with was to ensure that BORN data that is being entered by all hospital users was aligned with the BFI strategy in order to specifically facilitate reporting and subsequently from that be able to support quality improvement. So the data elements that are included in these reports where revisions were implemented this past April 2015, included intention to breastfeed, newborn feeding from birth to discharge, reasons for breast milk substitute, infant early attachment and feeding initiation, and postpartum feeding support. Not all the revisions to all of those data elements have been completed, but sort of either complete or temporary revisions as needed in order to develop the reports were implemented in 2015. There are some additional enhancements that are still to come, but they involve data elements that aren't used in these reports for now. So the next thing that we did was to move on to the report development process. And there was, prior to 2015, a report in the BORN information system called the BFI Statistics Report. And what we did is go back to, we didn't start with a blank slate, we went back to that report. It was developed from an older template based on BFI recommendations a number of years ago when the BORN information system was first launched in 2012, and that report was developed after that based on an older template. And so what we did is we went forward with that report to actually identify areas where revisions needed to be put into place to make it compliant with the new BFI standards. The second report, which is the very last line on this slide, it's called the Breastfeeding Indicator Status Report, is the report that's coming in October. So the the predominant information I have in my slides really looks at this updated BFI Statistics Report, the components of it. So the BFI Statistics Report template that we worked with is based on the Breastfeeding Committee for Canada BFI Integrated 10 Steps Practice Outcome Indicators for Hospitals document, and there's an appendices and a template for calculation of breastfeeding rates in that document. And that's what we started the ball rolling with, to look at how to align the BFI Statistics Report. So it actually reported appropriately and calculated rates based on the new BFI standards. So Linda has mentioned the fact already that previously the BFI Statistics Report and the BFI reporting was all based on full-term baby cohort, and the new standards are to report on all births. And so the new BFI report reports on all births within a hospital. It is limited to inborn births in a hospital. Its focus is on a cohort of babies born in your hospital, cared for in your hospital, whether it be in the postpartum unit or mother-baby unit, or also some care provided in NICU or special care nursery. Wherever care is provided following birth, and feeding data is collected on that baby, the report will pull data from that information. The new report stratifies cases based on whether or not there was general anesthesia with cesarean section or not, whether there were admissions to NICU or not, and based on all births, we have data you will see in the table that I show you that reports rates for all births in your given hospital, but we then break down those all births into 3 gestational age groupings: the full-term babies of greater than or equal to 37 weeks, the late preterm babies of 34 to 36 weeks, and the preterm grouping of less than 34 weeks. The source of data has also been changed for this new report, whereas before, because it was specifically focused on full-term non-NICU babies, the data came from the postpartum child encounter in the BORN Information System, which is an encounter that hospital users complete for collecting various information about newborn infants. This new report is based on 2 encounters, as I've said. So if there is an encounter started in postpartum child and that baby subsequently goes to NICU or special care nursery for a period of time, and there's an NICU encounter started and feeding data is collected in both of those places, then the coding system within the report searches for all of the information from both of those sources. We, in fact, have created a new data element, if you will, not something that's entered by the user, but something that is actually classifies each baby's feeding status by looking at both of those encounters, so that the baby can be classified as exclusively breastfed from birth to discharge, no matter where care was given, or supplemented in one or the other postpartum area or NICU or special care nursery, or both if that was the case. And so the babies are all, each case is classified as to feeding status. The reports provide data to track rates over time. You will see there's a little visual picture I have to show that over time you'll be able to monitor your rates by month, by quarter, by fiscal year, and that will accumulate as time goes by. There is a hot link to Chart ID that's built into the report if you run it in the biz to facilitate some auditing to help you with some quality improvement problem solving. And the indicators Linda has already described, and you will see again, so I won't belabor that with this list, but it's clearly outlined related to initiation, exclusivity, supplementation. So these few pictures, I just take you quickly through. If you have a log-on ID, a password to log on to the BORN Information System as a BORN user in your hospital, you would log on using your user ID, and you would get to your home page. And if you want to run the report, as you see the red arrow at the top, you click on reporting. That takes you to a screen that looks like this. The BFI Statistics Report lives within the Clinical Reports tab, which is seen here inside the red circle. You click on the Clinical Report tab, and that takes you to a long list of a variety of different reports, which may vary from person to person. It depends on what your user access privileges are designed or approved for. But if you have access to maternal newborn reports, you will see the very first report in the list is the Baby Friendly Initiative Stats Report, and you would click on that report icon there, and it will take you to a screen that asks you to put in the time frame that you want the report to run. So you can do a month, you can set it for a fiscal year, you can plug in a quarter. So you tell it the time frame you want it to run. You will have your own organization. It won't be blank. Your organization would be there. The report will run for your organization only. The organizations you have privileges to, if there are multiple. And then this is just a little note to point out to any of you who can't seem to find the report or wonder if you have privileges to report access for this type of report in your hospital. Just a little cue to say check with your local BORN administrator in your hospital to check for those privileges and sort through the permissions required for you to have access. So this is, I have a series of just 3 pictures because the table where the BFI Statistics Report Summary Table, when you have gone requesting the table, you've plugged in your time frame, and this report is illustrated that I have plugged in a 2-year span from April 1, 2013 to March 31st, 2015. And so once you plug in your time frame, it will generate a table, data table that looks like this. But because for me to show it on one screen, it would be too small to read. And I know this is small in and of itself, but hopefully you get the point. So if you can just use your imagination and imagine that this slide and the following 2 slides are one big long table that can be expanded or condensed, reduced in size to show the different time frames you want, a fiscal year, a quarter, a month, that sort of thing. But all for the purposes for this presentation to just highlight some of the features of the table. So as we said, the BFI reporting requirements now ask that rates be calculated on live births, all births in the hospital. So of course you start off the report with the total number of births. You can see that the column headers break down your rates, your numbers, and your rates for categories that go from the total category of all live births down to those 3 gestational age groupings of full term, late preterm, and preterm infants. And then the right-hand side, you can see missing data. If there was missing data, it would be highlighted in these columns so that you could get a feel for the proportion of cases that are missing out of your numbers because there isn't feeding data entered. In other words, the system was not able to classify the baby. So here we have just general total numbers of live births. You have the numbers of births by cesarean section with general anesthesia, the number of births by cesarean section without general anesthesia, sorry, that was reversed, and then the number of infants, the proportion of your infants admitted to NICU. So you can see this gives you a flavor of what your population of babies is like, both based on gestational age stratification and based on some type of delivery and need for special care criteria. So it's an overview of the population of babies that you have that you're providing care for in your organization. So if you were to scroll down this table, and I'm now going to flip to the next slide, but the table would continue to scroll down, we're now getting into the breastfeeding indicators that Linda has described to you, and my slide included as well, so that you can see there's rates generated for breastfeeding initiation, exclusivity of breastfeeding, the number of breastfed babies who received at least one feed other than human milk, and that means human milk substitute or formula, as people commonly refer to human milk substitute sometimes, water or other fluids, juices, teas, etc., but not including medications, vitamins, mineral drops. This would not include sucrose, for example, for infant pain management, for needle sticks or IVs. That is not a feeding, that is a medication for pain management. And so the supplementation indicators B and C, and we've included a key. I hadn't mentioned it before, but we've included a key just simply as a short form of and a way of referencing some of these indicators with respect to brevity. So BI is breastfeeding initiation, A is exclusivity, B is supplementation with documented medical reasons, C is supplementation with no documented medical reasons, and then A, greater than 75%, there is a threshold set by the BFI program that is looking for 75% of babies to be exclusively breastfed human milk from birth to discharge in a completed fiscal year. So if you don't have, here you can see no across from 2013, 2014. That's simply because that fiscal year's worth of data is this is for illustration, by the way. These are just dummy numbers that are put in here for illustration. So it will generate a yes or a no for you based on a fiscal year's worth of data if you have achieved exclusivity of 75% or more in your population of babies. So the definitions are included, the trending over time is included, the numbers are included. Breastfeeding initiation is based on a denominator of all births. Exclusivity is based on those babies who start breastfeeding, and supplementation is based on babies who start breastfeeding. So using your imagination again, thinking of scrolling down the page, if you had your data table open on your BORN information page, we now see just the tail end of the table, and there are two additional components to highlight. The BFI program also requires or allows for an adjusted breastfeeding rate. We call it an ABF rate. And that is the combination of your rate of exclusively breastfed babies or babies supplemented with any feeds other than human milk because of documented medical reasons. And therefore, if you've not been able to achieve a rate of exclusivity alone of 75% or more, but combine that with appropriate use of supplementation for documented medical reasons, given the variability of baby populations across hospitals, the 75% threshold is applied to the adjusted breastfeeding rate. And again, you will get a yes or a no if you've achieved that rate. The very last few rows of missing data appear if there are missing data, and you will see these are hot linked. They're blue with a line under them. This was a beginning step to help with some auditing. If you've got a large proportion of your baby population where there's missing data for any of the data elements required to calculate the rates for these indicators, those cases will be flagged here. If you click on the hot link, it will take you to a list of case IDs, that give you some direction and a place to start to go and track down those cases and complete data that may be incomplete in your system. So it gives you a wee bit of idea. If there's anything there, if there's no missing data, then there will be no hot link. So that's the BFI statistics summary table in its entirety with its different components. This is just a picture if we took key A, or just the row that was reporting the infants exclusively breastfed, this just illustrates the time breakdown, that you can expand your table to go from your fiscal years down to a given quarter of the 4 quarters in the fiscal year, and you can expand the quarter line item to break down into 3 months. And so you're reporting, if you want to get, you don't have to have your table expanded to the point where all of this information is displayed, but you can if you need to drill down looking for specific issues or specific rates over time related to some of your quality improvement or some issues that might have happened in your hospital. It gives you some flexibility in how you configure this table to support the work that you are doing. This is just a picture. If you did click on the hot link for missing data elements, you will get the chart ID list, and that gives you a place to start to go log into the cases, the record level data you've entered into the BIS in order to complete some missing data that might be there. And you will have had a clue, as I flip back here, about what data is missing. So there are 24 cases in this illustration where the data element newborn feeding from birth to discharge was missing from postpartum child or NICU. And again, 21 cases where there was missing data for reasons for supplementation. And we need that data, as you remember, in order to classify the case as to an exclusively breastfed baby from birth right to discharge, or a supplemented baby, whether it was in postpartum or the mother-baby unit for various reasons, or it was in the NICU or special care nursery. So flipping ahead here, these few slides are some additional tabs, and I know this is quite small. I simply included them to emphasize that the BFI Statistics Report that we just looked at, listing the indicators, is one tab. When you open up that report, it will be the first tab in a series of 5 tabs. That BFI, the first tab, the BFI Statistics Report, is the one that has had the major revisions to it. The 4 other tabs that exist that I will just flip through quickly as a placeholder in the talk to simply say to you, we've made minor revisions to these 4 tabs, not significant changes, just simply aligning them so that they are pulling data from the same aggregate data element that combines postpartum child and NICU data if both encounters are created, and looking at the denominator of all births. So this particular tab provides information on the distribution of live births by gestational age, the type of transfer, where the baby went, whether it was home, to the NICU, to a PEDS unit, or a CAS apprehension, and by hospital of birth. So I don't want to, the focus of our work was really on that first tab. I don't want to belabor too much time on these, but just wanted to make the point essentially of saying we've revised them to be concurrent with the BFI Statistics Report, but haven't really changed anything about the information they report. So the next tab is the proportion of babies, the proportion of infant feeding type from birth to discharge by hospital. So that's looking at whether there was breast milk only, breast milk substitute, combination feeds over time. This happens to give you some trending bar graphs over time to show you how whether your population and feeding type changes. And then the next tab looks at distribution of breast milk substitute for medical and non-medical reasons. And it, of course, gives you a breakdown just by those 2 categories and trends over time. It gives you bar graphs. So these are, again, compliant with just reporting your hospital rates, but gives you just a quick look to be able to trend over time what's going on and whether or not there's movement. In particular, when you see the next few slides I have, which are reporting Ontario rates, for you, this will be helpful because, of course, it's the non-medical supplementation that is the focus of most interest here. And the final tab in the BFI Statistics full report is the distribution of type of infant feeding from birth to discharge by type of birth, whether it was vaginal or cesarean section births for multips or nulliparous women. So that's the basics of what the report includes with the extra tabs. Here are 5 slides, I believe, to give you a snapshot. If we look, it's 1 fiscal year's worth of data, so just let me orient you to what you're seeing. It's a bar graph with each bar representing a hospital. It's reporting 93 hospitals and provincial data with median rates. The green line in the middle, you see, this is breastfeeding initiation rates in Ontario by hospital for the fiscal year 14-15, and you'll see the variability goes anywhere from 34.8% initiation in the lowest rate hospital. We've just put them in chronologic order, or order from ascent, highest rate to lowest rate, with the hospitals anonymized. Right up to 97.6%. The median rate is 87.2%, and the Ontario rate, if you aggregate everything together, is 84%. And so I wanted to present the rates over the fiscal year for us to get a snapshot of the variability in practice that is happening there. So in essence, there is generally good initiation. Doesn't mean everybody's initiation rates for their populations are equitable, but you can see the area under the graph is pretty full. So one of the objectives, as Linda described, was to target breastfeeding initiation rates. So the next indicator is exclusive breastfeeding rates. So it's the same orientation. Each bar is a hospital. The green line is the median rate in Ontario, which is 60.9%, or the median rate. The middle rate of all the hospital rates falls at 60.9%. The variability across hospitals of the 93 hospitals reporting is 87.7%, right down to 17.1% of their all babies born in their hospitals were exclusively breastfed, so huge variability across hospitals. And the Ontario rate is the red line, 53%. The red bar is 53%. The 75%, the wide red horizontal line I've inserted on the graph is approximately where that 75% threshold would be. That is the target threshold for the BFI initiative. So you can see the area under the graph. There is a lot of blue, but the white below the red horizontal line is where exclusive breastfeeding is not happening. And that is, we certainly do have hospitals exceeding that 75% threshold, but the vast majority are not. And this suggests that there certainly is work to do, and the BFI strategy and the work being spearheaded by the collaborative implementing the strategy across Ontario is targeting this. So that's number 2 indicator. The next 3 slides are about supplementation. So this is supplementation rates with documented medical indications, which is appropriate use of supplementation. And I've added the definition at the top, which is really just pulled from the data table that you saw on the earlier slides. So this is supplementation. Remember, this is classifying every baby, every inborn case, as to whether or not the baby received anything other than human milk from birth to discharge during care in your hospital, whether it was in the postpartum unit or mother-baby unit, whatever you call it, or whether it was during a time of admission to an ICU or special care nursery. And so the rates vary from 20.3 down to no supplementation for documented medical indications, with the median rate of hospitals being 8.3 and the provincial rate being 5.2. So that is, we know supplementation for medical indications is appropriate, is sometimes needed, and this is a reflection of the variability of use of supplementation with documented medical indications at this point. So this is looking at supplementation rates with no documented medical indications. And again, the rates vary extremely from a high of 69.7 to a low of 2.0, with the median being 19.8 and the provincial rate itself being 26.9. And again, this is infants who receive at least one feed other than human milk without any documented medical indication. So I've taken one additional step and combined those two bar graphs. I know some people are not comfortable with stacked graphs, but the point I wanted to illustrate here, if you, in this particular graph, you will see the red part of the bar reflects the rates that we just saw where supplementation was provided for no medical indication. The blue part of the bottom part, or the blue part of the stacked graph, reflects supplementation where there was documented medical indication, and the height of the bar is the, therefore, overall supplementation rate for each hospital for the fiscal year. So again, supplementation is happening in some places. 3 of every 4 babies are being supplemented, right down to a low rate of 5.6. We couldn't get the Ontario rate to be a consistent bar color, so I've pointed an arrow at where the Ontario rate falls, which is 35.2. And so what you can see here is that the majority of supplementation that is happening is for no documented medical indications, and that suggests there's some work to be done to sort out what is driving that, what are the triggers, what strategies might be in place, how much of that needs to be addressed. Just an interesting reflection. And this final slide is the adjusted breastfeeding rate. Remember, I said the 75% threshold is applied to your exclusive breastfeeding rate, but then if not achieved, if there isn't a 75% rate achieved with looking at exclusive breastfeeding in your organization, if you combine the exclusive breastfeeding rate with the supplementation, appropriate use of supplementation for documented medical reasons, do you achieve it with that? So this is illustrating that once you combine the two rates, we do see that there are a few more hospitals reaching the 75% threshold, but still a considerable number below the red horizontal line, with a range of 92.2% right down to 19.5%, and the Ontario rate sitting at about 60%. So that gives you a snapshot of where we stand. The BFI initiative was, although there was a lot of preparatory work being done prior to the fall of 2014, the launch of the program and the release of the resources and the education began in earnest in October of 2014. So this will be very interesting to monitor over time as that initiative picks up steam and as organizations go through their planning process for implementation of different strategies that they wish to target over time. This last 2 slides, and then we will wrap up for a few questions, is just a quick picture about what the new BFI Indicator Status Report that is going to be launched October 7th. Stay tuned for announcements and webinar login information for that. Essentially, it is the same indicators as we just discussed: initiation, exclusivity, supplementation, and adjusted breastfeeding rate. The different features here are that it provides comparator data for your hospital. And so there will be your own hospital. You can see the column headers here, your own hospital data, your peers that are other same level of care hospitals, other similar volume of birth hospitals that are your peers, your LIN aggregate rate, and the Ontario provincial rate. and it will be based on hospitals with acknowledged data, as well as provide some additional information, breakdown by gestational age. This next slide just shows you one example. Again, we've looked at the row that is the exclusive breastfeeding rate, and you can see here in this table it will provide data based on the 3 gestational age groupings we talked about in the previous report, plus yearly, quarterly, and monthly breakdown of your rates over time and the comparator data over time. This report will have the added hot link features to take you from any of the data that's in the any of the N data, your numerator data, down to not only the case ID but also right into the hot link to a second level down into the record level data entered into the BIS to facilitate auditing. So we don't have time today to go into any more detail. I just wanted to be able to do a little bit of a show and tell to say the comparator data is coming. We tried to build a report where both features were included in one report, and it was just too cumbersome to do. So we've focused on the revision to the BFI Statistics Report, which is what I've spent most of the talk describing, and then have this new comparator report ready to go very, very shortly. Acknowledgments, I would be remiss without acknowledging tremendous work by so many people, both within the BFI Strategy Implementation Committee, the consultations we've had with Marianne Brophy and Kathy Venter at the Breastfeeding Committee for Canada to help all of us work through the definitions, inclusion, exclusion criteria, and refinements to build these reports. The tremendous work on the BORN enhancement team. They've just been a fantastic group that have worked very long and hard, and kudos to everybody on this list, and as well as the DAPASoft report developers. So this was a long, very detailed process, but a tremendous experience all the same, and we hope that it is a resource that will facilitate reporting, whether you choose to go down the journey for BFI accreditation or to increase your BFI strategies and your breastfeeding support in your hospital. So that is all I have to say. I'll pass it over to Kathy. I know we're close to the end, but if there are any questions that we can take for the last few minutes, Linda and I would both be happy to respond.
Great. Thank you, Sandy. So just a reminder, there's a chat box in the bottom left-hand corner of your screen. Feel free to type one in, and there is one already, Sandy, and it's asking if the BFI reports are available to the public health units, or is it just a hospital-specific only report at this time?
Yes, it's just a hospital-only specific report at this time. There are discussions that will be happening to look at, because the BFI initiative, as you know, is not just, as Linda clearly described, is not just focused on hospital care, but on community-based care provision as well. And so there are discussions underway to look at reporting requirements. And of course, the BORN information system has hospital data in it. We wouldn't be able to provide data at this time to inform reports where about breastfeeding duration long term, but please be assured that we are talking together to identify where we can support public health unit reporting.
Great, thank you. There's no other questions in the chat box at the moment, but I'd just like to mention that the new BFI Indicator Status Report that Sandy had a moment to go over, there will be a training webinar for BORN users on the use of this new report, and it's going to be held on October the 7th from 12 to 1. An announcement will be coming to you all early next week, so stay tuned for that. And just while we have another moment, our next scheduled BORN provincial rounds is Thursday, November 19th, and our topic will be fetal alcohol spectrum disorder, and we'll include a BORN data review. Our presenter will be Kelly Oreskowicz. Kelly is a master's prepared social worker and a registered nurse in the FASD clinic located at the Northeastern Ontario Health Centre for Kids at Health Sciences North in Sudbury, so we're looking forward to that. There's another question here. For small hospitals with very small birth volumes, are these dealt with in the same way?
Yes, I mean your volume is your volume, so your denominator would be smaller, your numerator would be smaller. Obviously, with small birth volumes and small numbers of cases reported in the numerator, there's going to be less stability to the point estimate or the rate that's calculated, and that's why we've tried to build in information to help you both looking at ensuring your data is complete, so flagging missing data to help ensure everything that you can report is reported completely. And when the comparator report does come out, it will be based on the comparator rates are based on acknowledged data, looking at a minimum number of at least 3 hospitals need to be acknowledged in your peer group to be able to have a rate generated, but that gives some confidence to whether or not the peer comparison rate is reliable or not. So yes, it acknowledges for sure the rates fluctuate, and that's why it's also important to look at rates and trends over time. So where you may have small volumes, you don't just look at 1 month, but you look at a series of months, a series of quarters, and looking at your trends over time as opposed to just one estimate of the rate, because there can be some significant fluctuations.
Thank you, Sandy. So it looks like we're out of time, and I'd just like to thank you and Linda again for an excellent presentation. Great review of the BFI strategy for Ontario, the overview of the BORN BFI Statistics Report, the indicator rates were very interesting, and also for the sneak preview of the new BFI Indicator Status Report. And just to mention again, it'll be live October 7th, and we will be having a training webinar on that day. So thank you both very much, and thank you to all our listeners for your attention.
Thanks, Kathy. Thanks, Linda.
Thank you.
Bye, everyone.
Bye for now.
Bye.